name is Dr. Imran Bin Ramli. My research is mainly on rehabilitation engineering, so it's more on clinical side of the biomedical engineering. My project currently is focusing on implementing singing therapy among spinal cord injury population. If you are not familiar with spinal cord injury, so we have a lot of levels of injury, level of spine, right? It's sacral to lumbar to thoracic to cervical. So you imagine if someone was in an accident, for example, and then they were paralyzed, right? So the higher the level of injury is actually involving the spine, the more body parts that will be paralyzed. If your injury is very high, you have C1 until C8. So let's say from C4 or C3, that's your level of injury, your diaphragm is definitely affected. So it's gonna be affecting the way you breathe. You're gonna have experiencing shortness of breath, you're harder to sleep. Conventionally, these patients, spinal cord injury patients, will have to undergo a conventional therapy session where you have a tube and you have 3 balls, and the doctors will ask, inhale and make sure all 3 balls will float for quite some time. And if they are able to, they consider it as good. And imagine doing that every single day for a few months. Other than that, they might ask you to do simple breathing techniques like things like that. So you can imagine it's not only monotone, the data is also very one-dimensional. So you can only see if the patient is able to float 3 balls, but you don't know which muscle are they actually using, because you know if they are high level of injury, definitely more muscles will be affected, including the respiratory muscle. So singing therapy is coming in as an alternative method. It's only relatively newer technique that was being introduced, I would say in the past 10 years at least, but definitely not in Malaysia yet. We also are collaborating with music department in Faculty of Creative Arts. So this is a collaboration between 3 faculties, me from Faculty of Engineering, and Professor Nazira and Professor Julia from Faculty of Medicine, and Dr. Mazlan from Faculty of Creative Arts in Music Department. So their team actually came up with categories of song. So they categorize them according to the pitch of the songs, high or low, and then the tempo, high or low as well, and also the rhythm. Is it easy or is it hard? What I found out, or the main outcome that I had recently, is that we can see that different songs actually led to different muscle activation. For example, slow tempo songs, maybe songs like nothing's gonna change my love for you, things like that. So it's very low pitch, very bassy. The data, the sensors that we use picked up only on or at least mostly on the abdominal muscle. So we use 2 sensors, we put it on the abdominal muscle and the neck muscle. So every time they breathe in, we picked up the data and we analyze the data, how much the muscle is being used while they are breathing in and breathing out while singing. So we found out that those kind of categories of song, like very slow, very mellow, abdominal muscle is more active, neck muscle is very relaxed, nothing much is going on there. But when it comes to high tempo songs like Hello by Beyonce, I'm not gonna sing that, but it's very high pitch and it's very hard to sing. We could see that the muscle that they are being used is more towards neck. Abdominal muscle is very relaxed. Maybe in the future, we have a better clinical guideline for spinal cord injury that wants to implement singing therapy. Let's say the doctors look at the patient and they say, I think I would like to strengthen your abdominal muscle. So if this clinical guideline can be more fine-tuned in the future, I would say, okay, doctor, based on our research, we can see that if the patient is comfortable with singing therapy, these are the kind of songs that you should focus on.